when men hold back. With International Men's Day taking place on the 19th of November, we explore the health challenges men face, the barriers to accessing care, and how podiatrists can play a vital role in encouraging them to take action. This story for the Podiatrist was written by Katie Smith. Part 1. Introduction. Plantar fasciitis, Achilles tendinopathy, ingrown toenails, and fungal infections are among the most common foot and lower limb conditions men face. These can all impact daily life, whether it's work, playing sports, or socializing with family. Yet wider health challenges such as diabetes and vascular disease can increase the risk of foot and lower limb complications, including amputation, if left untreated. Indeed, global research on diabetes patients between 2010 and 2020 reveals that men have twice as many amputations as women. It's therefore important that men have regular foot checks to ensure early detection of issues that may lead to ulceration, hospital admission, or amputation. Jane Robbie is a senior podiatrist specializing in diabetes at University Hospitals Birmingham NHS Foundation Trust and senior lecturer and course lead at Birmingham City University. Through my work in a secondary care high-risk foot clinic in a large city teaching hospital, I see a lot of men with long-term conditions, she explains. They are frequently middle-aged white men, often single or living with elderly relatives. They frequently present with suboptimally controlled diabetes, neuropathic ulceration, ischemia, non-healing wounds, and sometimes sepsis. Part 2. A wake-up call. Alarmingly, a quarter of men delay seeking help for health concerns, according to a study by Bupa. Among the reasons for this are ignoring the issue in the hope it would go away by itself, fear of bad news, and having no time. The Movember Institute of Men's Health found that nearly 2/3 of men wait more than a week with symptoms before visiting the doctor, and 31% will wait more than a month. In the Real Face of Men's Health report, 62% men revealed they want to leave their healthcare practitioner due to a lack of personal connection. Men frequently present late or delay help-seeking activities. Jane explains, they can be disengaged with their health, don't take medication as prescribed, don't wear offloading shoes, and go to work when told to rest. They may have manual or low-skilled jobs, which makes it difficult for them to be concordant with treatment or attend appointments. There are also underlying psychological factors to consider, says Bewsey, a chartered counselling psychologist working at St George's Hospital Diabetic Foot Clinic in London. They might be depressed and therefore not motivated to seek help or find it stigmatizing to go to their GP or podiatrist, she explains. Topics like mental health can feel awkward or shameful, so conversations might be avoided. There's also fear of vulnerability. If men have health concerns, it might be seen as a sign of weakness. In contrast, she adds, some men on the wards may have a bravado attitude or fatalistic approach. What will be, will be. A few men actually justify having an amputation. I had this coming to me. Others say they didn't take much notice of what they were told and couldn't see the damage diabetes was causing. Getting bad news about the risk of amputation is often a wake-up call. Part 3. Protecting patient mental health. Catherine, who counsels patients through their diagnosis and treatment, says, what can help protect a patient's mental health is clearly explained, written and verbal information about what to expect when they have an amputation. A lot of worries are around not knowing what's going to happen. If a podiatry team has access to a psychologist and/or they have attended psychologically informed training, it can help them to prepare patients for surgery. I work as part of the pre-amputation pathway, so if a patient needs an amputation, they'll usually be offered the opportunity to see me. I try to help them process the loss. I also support the foot care team when they need to have difficult conversations with patients. Their feelings may include denial, anger, and guilt, Catherine says, adding that they can often bargain and want to delay and try another treatment before accepting they need amputation. Validating fears around amputation and reassuring patients that they will be supported throughout this journey is important, she says. Removing parts of a foot and/or undergoing major amputation is a major life event. It's like losing a part of yourself, so it can challenge a person's concept of themselves. It's also crucial to involve family and carers and let them know what to expect, she adds. Part 4. A postcode lottery. Practical barriers are also apparent. Paul Galdas, Professor of Men's Health at the University of York, says, "The evidence shows that many men often delay seeking help, not because they are unaware, but because the system doesn't work well for them. Issues such as long waits, inconvenient appointment times, and, crucially, services that feel unwelcoming and unfamiliar often make it harder for a lot of men to get help. Social expectations around being tough, stoical, or not wasting the doctor's time add another layer. There's a lot of evidence that masculinities shape men's health-related behaviour, but the bigger story is how services respond, or fail to respond, to men's needs based on this and other well-known barriers." The Real Face of Men's Health report, which Paul contributed to, also revealed disparities between the most and least deprived areas in the UK. It found that men living in Ladywood, Birmingham, on average, were more than 3.5 times as likely to die prematurely as those in Beckenham, South London. The gaps between men in the most and least deprived areas are definitely one of the biggest challenges in relation to men's health in the UK. Men's life expectancy in different areas can differ by nearly a decade, he says. It can feel like a postcode lottery, but it's really about structural inequality. Men in poorer areas face higher health risks and greater barriers to care, yet have fewer resources to protect their health. Part 5. Awareness into action. So what are the solutions to fixing the relationship between men and accessing healthcare? First and foremost, Paul says, it's too simple to say men are unaware of health problems, and we're working hard to change this narrative that it is somehow the fault of men individually. Most men know when something is wrong, but they often minimize symptoms or put off acting because of work, family pressures, or fear of wasting time in the system. Awareness is often there. The problem is turning that awareness into action. Strengthening men's health literacy is critical, not just knowledge of conditions, but the confidence, skills, and support to act on that knowledge in everyday life. We don't just need more awareness campaigns, we need real changes in services to better meet men where they are at and support them to take appropriate action to look after their health and well-being. Crucially, he explains, we need to stop blaming men for not turning up and start reshaping services so they fit better with men's lives. That means flexible access, clearer communication, and framing health as something that enables men to do the things they value. For example, work, time with family, and sport. This year, the UK government revealed it is in the process of developing England's first ever men's health strategy as part of its 10-year plan for the NHS. It aims to bring a renewed focus on preventing adverse health outcomes and reducing health inequalities for men. Paul is working closely with the Department of Health and Social Care, as co-chair of the National Men's Health Academic Network, advising on the men's health strategy for England and ensuring it is evidence-led and focused on outcomes that improve men's lives. The men's health strategy is an opportunity to move from isolated projects to a joined-up approach across the NHS, he explains. Part 6. Making a difference. The role of podiatrists in encouraging men to take action in terms of their health should not be underestimated. Podiatrists are well positioned to make a difference because foot problems are visible and affect daily life, Paul says. General approaches that have been shown to work include keeping the conversation practical. For example, link foot health to staying active, working without pain, or keeping up with family. Use straightforward language, focus on solutions, and connect foot issues with wider health concerns like diabetes or circulation that disproportionately affect men. Jane agrees. Podiatrists are uniquely placed as they frequently have regular appointments with patients over extended timeframes and are ideally placed to have difficult conversations or discuss sensitive matters. However, she says, they need support or training about how to frame these conversations for the best effect. Also, building links with interprofessional colleagues or multidisciplinary teams can ensure there is a cohesive message and reinforcement of any education or advice. Patients need an advocate too, and podiatrists can often help them to navigate their ulcer journey. Non-concordance is admittedly a challenge. People can be quite resistant to change, Jane says. Understanding motivations and possible reasons is sometimes a way to gain some influence. My experience is that if you are confident, non-judgmental, and consistent in your message, you can sometimes get results. Engaging men sometimes requires novel approaches, so talking about what they are comfortable with, music tastes, or the latest sports scores are sometimes ways of gaining trust and building rapport. When it comes to mental health, podiatrists can and should signpost patients to GPs or mental health professionals. However, they can practice active listening and suggest places to find help. If in doubt, check the HCPC guidance. Part 7. Flying the flag for men's health. Men's health and well-being charity, the Blue Ribbon Foundation, was born after co-founder and chairman Jonathan Prince recognised that men don't do health as well as women. We try and encourage men to be more health and well-being aware, he says. Well-being is not just the absence of ill health, it's about how you're feeling, and that's vital because it can affect a person's mental health. He urges men to maintain friendship groups and stay healthy. Particularly for mental health issues, you do need a confidant you can chat over things with. The key is that you leave someone with a message. It's up to them to act on it, he says. The Blue Ribbon Foundation is part of a national network of charities supporting men's health. Jonathan says, collaboration can have more of an effect than an individual voice. Part 8. Top tips. Listen carefully to patient concerns. Empathise. Keep the conversation practical. Use straightforward language. Be confident, non-judgmental, and consistent in your message. Signpost to psychological services or mental health resources if needed.